Hi, I'm John Veely, CEO of Online Visas. Welcome to Facebook Live and our YouTube channel, Online Visas YouTube channel. Welcome back. It's Monday, the 30th of April, and we're still in the COVID pandemic. This is Immigration Solutions during the coronavirus, and John Veely, CEO of Online Visas, here to talk about what's happening now. So last time I broadcast was episode 5. On Friday. It's now episode 6 here on Monday. So a couple of things, just immigration housekeeping. USCIS will process extensions of employment authorization documents now without having to go do the biometrics. Those are fingerprints. You can send them in without that. We've seen that emergency consulate adjudications can happen for doctors, those sort of things, so that's a good thing. But here's where we are in the stats. You probably know this from lots of other places, but 456 deaths today in the United States. That's massive. We heard we had 200 on one of the days over the weekend, so that's pretty rough. I see Kenny Four Hands watching, and JT Thatcher, Brent Sanner, thanks guys, Shannon McCarty, thanks so much. Cases in the United States, we're at 156,400, 2,915 deaths. It's getting very serious, and it's getting closer to home. 770,600 in the world and 36,000 deaths in the world. Somebody close to me had some symptoms. We took them to the urgent care facility and were tested. Unfortunately, the testing where we're at isn't quick, and it's not for everybody, so we won't know for a couple of days. So that's why you see me working here. Not worried about it. That person is feeling better, breathing well, doing things. They were prescribed the arthritis medication that the president has been talking about. We'll see if that's helpful in a breathing treatment. That was all good stuff, right? So we're hoping that we see that wasn't a problem, but will be cured quickly if it's not. A couple of things I want to talk about. There is the president has said that he was hopeful this disease would be over by Easter. He's backed off that of today. I think it sort of floored him a little bit to see his neighborhood in Queens attacked so harshly. Refrigerated truck out back with the for a morgue is nothing to to be happy about or too upbeat about, right? So, everybody is, trying to get a little bit more concerned about this, obviously, but we need to keep our heads up. Enjoyed it with my family over the weekend. We all stayed close to home. My daughter, who lives outside the house, came in and we barbecued, and we practiced social distancing by not getting really close to anybody else, but we kept our family close, and that was kind of nice, right? And so nice spring day, and you got to enjoy that. So, that's kind of where we are there. I see Paul Goods out there, Mariana Cobra, the excellent soccer coach, is out there. Anna Klueva, extraordinary ability in media. Thanks for coming in. Venkat Baklani, thanks for showing up. Brenner Roth, good to see you. Steve Hyatt, really enjoyed catching up with Steve and other members of the 1988 National Championship rugby team from Cal Berkeley. A lot of fun to just text those guys. I mean, these are the positive things that are happening during this tough time, is communicating with people while we're all stuck at home. I see Chino Martinez there, extraordinary ability skier from Chile at Aspen. Saw him out working out. He's trying to stay fit and come back up here and do a great job for our ski industry. Look, what are we going to do? So there's some things that are coming out. I understand that the SBA site is now up again, and you can learn some things there. Try to catch up to see the difference of a disaster relief loan and what is going to be this payroll piece, right? We're hoping that the payroll piece, as it's part of the CARES Act, will be coming out soon. A lot of companies really need to get that money so they can keep people on payroll, especially the restaurants, the hotels, things like that are, had to shut down. they want to keep their people employed, and this is to really provide about 4 months of that. So make sure you look into that and get with your lenders. I believe they're starting to understand that, and see where we go from there. What other things? Right, doctors. So talked about emergency consulate adjudications for doctors. That's a good thing. And the J1 visa might be one of the saving visas for us and the medical profession. The J1 would match people, doctors, with programs that would get them in. They come in as foreign medical graduate students, learn medicine in America, and they can help out on this thing. And so all the matches were done not too long ago, but it looks like they're opening up the non-matches again. We have a lot of contacts in India with doctors, a big group there. A good friend of ours has a pipeline of about 5,000 doctors, many of which you want to come over here. And those who had not met the matching for the J1 programs have all been issued letters again. So the J1's a program. It often has a 2-year home residency requirement for these doctors, but there is a way that they don't have to go to their home country, go back to their home country if they go to medically underserved areas in the United States. That is a program. They spend 3 years there, and we're hoping that as this time goes on and our doctors who are getting sick on the front lines and nurses and all our healthcare professionals, that we're going to need to have some people come in and spell them, right? Well, so the J1 visa could come, and in having the H1B available for more of the United States, or maybe all of the United States could be designated, is that as long as they were helping in an area that would help alleviate what's happened because of the coronavirus, that would be a good result. A lot of people don't know this, but 17% of all of our healthcare workers in the United States are immigrants, right? So if you've been somebody that's been negative on immigration, thought that immigrants were problems, 17% of our healthcare are immigrants right now. 1 in 4, or 25% of all the doctors in the United States are immigrants, right? And many more are willing to come here and help us. And what we're trying to do is see if the United States immigration process and the State Department can make that process easier, right? So what can they do? Well, in my opinion, they could waive H-1Bs. Waive the licensure for the H-1Bs, right? You need to have a state licensure to come in and practice medicine in the United States. So it makes a lot of sense, right, in normal times. But New York just waived theirs, right? So if you can meet the other qualifications for an H-1B, then you can begin working as soon as you get that in New York, even without having a temporary New York medical license. Now, you understand that because they are just really ratcheting up their problems, and we need to get the people there now. Some of the problems with the J1 visa is some of those programs don't even start till July 1st. So State Department's in charge of that. They need to just loosen this thing up. If somebody's already been approved and into a J1 program, let them come today. Let them get through the consulates and let them get over here and start helping our people. Another thing that would make a lot of sense would just be raising the H-1B visa. The caps just hit. Matter of fact, some good news, we saw 50% of the visas that we put into the numeric cap, which went from March 1st to March 20th. They just released numbers today and will release more tomorrow, we think. But 50% of the ones that we put in made it. That was much better than the 44% last year. So that's a good thing. But that happened before the coronavirus really hit. What we need is more H-1Bs for medical professionals to come in. We also need to loosen up the TN visa, which allows doctors to come down from Canada or up from Mexico, but really not to be able to help with the seeing patients directly. Only 10% can go to that. So really loosen that up as well. Right now is an emergency time. We don't need to have the government getting in the way of doctors trying to help us. We need to loosen that stuff up completely. Premium processing is not available right now for a lot of visas. Premium processing for the medical professionals should be put back in there. Now, look, it's not just me telling you on this broadcast, but the American Medical Association's out there. I've seen a number of articles. Vox had a good one today. A couple others did. I've been watching it closely. We want to help doctors. If you know of anybody in the medical world that needs doctors, we have doctors that want to come and we can help them get here. Just put them in touch with us. You can contact me at onlinevisas.com or go to our on our website. You can private message me on this Facebook page. Anybody that can help at all, we want to get in and talk to people. I see Roland Morgan, Casey Cartnell, Matt Sturr, Robert Mariziti, and Mike Barrel are watching. Good to see you guys. Thanks for tuning in. Enjoy talking to you. Jenny Bai, my friend that I met in China from New York, is here. April Zielny, Aisha Ali, good to see you. Nanette Shadid Hathaway is watching. Good to see all you guys coming in. Thanks so much for tuning in. A couple of things. Just want to make sure everybody's doing well. These are tough times. I know we're all bored, senseless, sitting in our houses. You can see I'm here. This is my basement. We call this the Illegal Smile Underground Saloon. We got a pub. It's sort of like a rugby bar, and we got a drum set and some guitars on the wall, and we like to have a bit of fun down here. But here's my part of my workstation now. I think that's what's all happening in our life. And on the Illegal Smile, I heard the bad news that the author and singer of that song, John Prine, has contracted COVID-19. So that's a sad thing. So we're all thinking about these folks. To me, it all feels like a train wreck. The train is long, and it started in China, and we heard about the cars going off the track there, and then it hit Italy, and saw those cars off the track, and New York is just getting slammed right now, but it's getting closer. I think more and more of us are knowing people that have it. I've just know some people have been tested for it, 2 that have been negative, and 1 that we're still waiting. But it's coming closer to us. So as it does in these next couple of weeks, it's going to get a lot more real. So keep your spirits high. Just here to talk. Anybody has any questions, private message me around immigration, but really just thinking about all of our friends and family all over the country, all over the world that are shuttered in. As an immigration attorney, I get to talk to the world every day. Talked to Singapore today, India yesterday. The whole world is on lockdown. It's really hard to believe. Chile, it's just strange, but we're all doing this. No one's ever done it before, not like this. So keep your spirits high. Hopefully we'll get through this and get through it quickly. But be well, and we'll see you tomorrow. This is John Veely, CEO of Online Visas. Take care.